If you've been told you're at risk of developing a pressure ulcer, it's important to ensure that you or someone who looks after you checks your skin for any changes. We would recommend this is done daily as a minimum. However, if possible, it should be done at every opportunity. This could be when you get washed and dressed in the morning, when putting on your socks or shoes, going to the toilet, or when changing your position in bed. If you rely on carers to help you check your skin, you may wish to ask for this to be added to your care plans, along with your at-risk pressure areas to check. Ideally, skin should be checked in a well-lit room or natural daylight. However, if this is not possible and there are any lighting issues, a torch can be used. Touch is also just as important as visual checking. The way the skin feels can tell us just as much as how it looks. It's important to be aware of your at-risk areas to know which areas to check. Here, the red dots show common areas on the body that may get pressure damage when you're lying in bed. If you are lying on your side, your pressure points can change to the ones on the side of your body. Your at-risk areas also change when you are sitting in the chair. If you have any contractures to the hands or legs, or difficulties with maintaining posture, then your pressure areas may differ from this. Pressure ulcers can occur anywhere on the body where there is direct pressure. A nurse or health professional will be able to help you identify areas of your body at increased risk. The easiest way to check your skin is to do the blanch test. This is carried out by pressing on the area for at least 3 seconds, then removing your finger. The area of skin may go white and then return to red, pink, or the other darkened colour within a few seconds. This is called blanching skin and indicates good blood flow to the area. If the skin stays red or dark, or goes white but stays white and takes longer than a few seconds to return, then this is called non-blanching or slow blanching skin and indicates that the blood flow to the area is impaired. Skin that is completely non-blanching is also referred to as Category 1 pressure damage. If you have dark skin, your skin may not blanch even if it is healthy. Therefore, it's important to look for other signs. Instead of going red, dark skin with early signs of pressure damage may go lighter or darker than usual, with grey, blue or purple tones. It may feel painful, numb or tight. The skin may feel softer or firmer or warmer than cooler than normal. Knowing what is normal for you will help you gauge if there are any changes to your skin. Use of a skin tone tool may be helpful in identifying your normal skin tone and recognising changes. You may also wish to compare the area to adjacent skin or take photographs for reference. Checking your own skin can sometimes be challenging as we can't always see the areas on our body, such as our bottom. However, using a mirror can help. Handheld or compact mirrors can be useful for checking heels or your bottom, so it may be useful to have one close by when you are preparing to check your skin. If you are still having difficulty, it may be helpful to ask someone to help you do this, either carers or a relative. Carers provided by an agency may have their own training on how to check your skin. However, informal carers or relatives who help you may not have the knowledge to recognise changes. You may wish to show them this video, or a nurse or health professional can discuss it with them and demonstrate how to do it. For further information, please discuss with your nurse or health professional.